video I'm going to talk about the kidneys. So I will be discussing about its parts, relations, covering, blood supply and applied aspects. So we have the kidneys. The kidneys are a pair of excretory organs situated on the posterior abdominal wall, one on each side of the vertebral column behind the peritoneum. So the kidney occupies the epigastric, the hypochondric, lumbar and umbilical regions. So vertically they extend from the 12th thoracic to 3rd lumbar vertebra. So the right kidney, it is slightly lower than the left, and the left kidney, it is a little nearer to the median plane than the right. It will be more nearer to the median plane. The shape, size, weight and orientation. So the kidney is 11 centimeter long, 6 centimeter wide and 3 centimeter thick. The left kidney, it is a little longer and narrower than right kidney. So the kidney weight 150 gram in males and 135 gram in females. So the kidneys are reddish brown in color. The long axis of the kidney, it is actually directed downwards and laterally. That is like this, so that the upper poles are nearer to the median plane than the lower pole. Each kidney, it is bean shaped, so it is having an upper pole and a lower pole, a medial border and a lateral border, anterior surface and a posterior surface behind. So the upper pole, it is broad and in close contact with the corresponding suprarenal gland, whereas the lower pole, it is pointed. So it is having two surfaces. The anterior surface, it is said to be irregular, whereas the posterior surface, it is flat. It has a lateral border which is convex and a medial border which is concave. Its middle part shows a depression that is called the hilum of the kidney. So the following structures are seen in the hilum from anterior to posterior side. That is, we have vein, artery, renal pelvis. So this is very important. Structures are arranged in the hilum of the kidney. Anterior most we have the vein, then artery, then pelvis. The renal pelvis, it is the expanded upper end of the ureter. Now about the relations of the kidney. So first I will be saying about the relations which are common to the two kidneys. The upper pole of the kidney, it is relating to the suprarenal gland. The medial border. So this is the hilum of the kidney. So above the hilum it is related with the suprarenal gland, and below the hilus it is related with the ureter. Now, so on the posterior side we have the diaphragm and the psoas major muscle, the quadratus lumborum muscle and the transverse abdominis muscle. Then there is a medial arcuate ligament and a lateral arcuate ligament. Then there are subcostal vessels. So this is the anterior relation. So on the right kidney there is right suprarenal gland. Then you have the liver. Here there is liver, and here there is a second part of the duodenum, and here you have the hepatic flexure of the colon, and here you have the small intestine. On the left side there is left suprarenal gland. Then here there will be spleen. Here there will be stomach. At here there will be the tail of the pancreas, and there is an area for the small intestine. Here will be the descending colon and the splenic flexure. So now about the capsule or the covering of the kidney. So this is the fibrous capsule. It is a thin membrane which closely invests the kidney and line the renal sinus. Normally it can be easily stripped off the kidney, but in diseases it becomes adherent. Outside the fibrous capsule, you have the perirenal fat. This is a layer of adipose tissue lying outside the fibrous capsule. It is thickest at the borders of the kidneys and fills up the extra space in the renal sinus. So the next is the renal fascia. It separates the adipose tissue of the kidney from the overlying pararenal fat. So it is a layer of connective tissue and encapsulating the kidney. It can be divided into an anterior renal fascia, which is also called as fascia gerota, and a posterior renal fascia, which is also called as fascia of Zucker-Kandel. Next one is the pararenal fat or paranephric body. It consists of variable amount of fat lying outside the renal fascia. It is more abundant posteriorly and towards the lower pole of the kidney. So here you can see it is more abundant towards the lower pole of the kidney. So this is a sagittal view. Now the structure of the kidney. So the kidney is having an outer reddish brown cortex and inner pale medulla and a space that is a renal sinus. So the renal medulla, it is made up of 10 conical masses called renal pyramids. The renal cortex, it is divisible into two parts. That is the cortical arches that form capsule. It forms the cap over the base of the pyramid. So this is a pyramid. This is the base of the pyramid and it forms cap. And the renal column of Bertini, it dips in between the pyramid. So each pyramid along with the overlying cortical arch form a lobe of the kidney. The renal sinus, it is a space that extends into the kidney from the hilus. It contains branches of the renal arteries, the tributaries of the renal vein and the renal pelvis. Each kidney is composed of 1.5 million uriniferous tubule, that is the nephrons. So each tubule consists of two parts. The excretory part called a nephron. So this is the nephron and the collecting part that begins from the DCT. So this is a DCT, this is a PCT. So the nephron, it is the functional unit of the kidney and it comprises renal corpuscles or the Malpighian corpuscle made up of the glomerulus and a tuft of capillaries and the Bowman's capsule. Then you have the renal tubules, that is a PCT, Henle's loop with its ascending and descending limb, and then the DCT. So here many tubules, it unite together to form the duct of Bellini, which opens into the minor calyces through the renal papillae. So this is the Bowman's capsule and this is the afferent arteriole. This is the efferent arteriole. The juxtaglomerular apparatus, it is formed at the vascular pole of the glomerulus, which is so it actually consists of the macula densa, JG cells and agranular cells. So the renal artery, it gives 5 segmental branches. So 4 from the anterior division and 1 from its posterior division. So the segments are on the anterior aspect, superior, then anterior-superior, anterior-inferior and inferior part. On the posterior aspect, one segment, that is the posterior segment. The blood supply of the kidney is from the abdominal aorta. At the level of L2 vertebra, the renal artery will come. The renal artery divides into 5 segmental arteries and each segmental arteries, It gives lobar arteries. It becomes interlobar arteries, then arcuate arteries, then interlobular arteries. Then it goes into the afferent arteriole, glomerulus, efferent arteriole, peritubular capillaries. Then the interlobular vein, arcuate vein, and interlobar vein, then lobar vein, then 5 segmental veins. It drains to the renal vein and then to the IVC. So this region, it is a avascular line, that is a Brodl's line. The lymphatic drainage of the kidney is to the lateral aortic node. Nerve supply, the kidney is supplied by the renal plexus. The common diseases of the kidney are the nephritis, pyelonephritis, renal stones, tumor. The angle between the lower border of the 12th rib and outer border of erector spinae, this is a renal angle. The most common anomaly in the development of the kidney, it is a horseshoe shaped kidney. The lower pole of the kidney fuse together. Actually, kidney is formed in the pelvis region and it ascends up. So during its ascent, the inferior mesenteric artery, it prevents the ascent of the horseshoe shaped kidney. Another applied is the nutcracker syndrome. The left renal vein, this is the left renal vein, which is crossing the aorta in front and below the superior mesenteric artery. So the compression of the left renal vein in between the aorta and the superior mesenteric artery will cause nutcracker syndrome. So the left gonadal vein dilate, that is this vein, left gonadal vein dilates, and the left pampiniform plexus of veins, it also gets dilated and resulting in varicocele or bag of worm consistency. In the covering of the kidney, I just forgot to mention that the superiorly the fascia splits and encloses the suprarenal gland and it blends with the diaphragmatic fascia. And the fascia of the fascia succercantile, that is the posterior layer, it passes behind the kidney and it blends with the fascia over the psoas major and the quadratus lumborum. So that's all.